What if a colony of bacteria living inside you right now is quietly inflaming your arteries, and your doctor never tested for it? In this video, I'm going to show you 5 hidden gut factors that research now links directly to uncontrolled blood pressure. Here is the foundation you need to understand first. Inside your intestines live approximately 38 trillion microorganisms, bacteria, viruses, fungi. When your gut bacteria are in balance, they produce compounds that help relax your blood vessels and regulate inflammation throughout your system.
This community for your gut microbiome PAO is not just sitting there digesting your food. It is actively communicating with every organ in your body. But when that balance is disrupted, a state we call dysbiosis, the opposite happens. Your gut starts producing signals that inflame, not protect.
Research from the American Heart Association now suggests gut-driven inflammation may contribute to high blood pressure in millions of adults worldwide.
After age 60, your gut microbiome changes significantly, and most of those changes make you more vulnerable to exactly what I'm describing.
Studies show adults over 60 have 30 to 40% less bacterial diversity than in their 40s. That diversity is your primary gut protection. In my practice, I regularly see patients on 2 or 3 blood pressure medications who still can't hit their targets.
This decline is silent and cumulative, shaped by decades of medications, diet choices, and chronic stress that nobody connects to blood pressure. 5 gut factors, ranked from contributing to critical. By number 1, you'll understand your blood pressure in a way your doctor has never explained. Their cardiologist treated the symptom. Nobody addressed the source. That gap is exactly why I made this video, Carl, and why you need to watch all of it.
The medical community is only beginning to take this seriously. Most practicing physicians were never trained on gut cardiovascular connections during medical school.
That's not a criticism, Hab, it's simply a gap. And closing that gap for you starts right now. Let's begin with factor number 5.
Factor number 5, the gradual disappearance of fiber-fermenting bacteria from your gut. This is the most overlooked cardiovascular risk factor I know of. Butyrate signals your blood vessel walls to relax. It acts as a natural vasodilator, working directly alongside your arterial system to reduce vascular tension. When butyrate-producing bacteria disappear, that natural signal goes quiet. Your blood vessels lose a key regulator. Studies show hypertensive adults have up to 50% fewer butyrate-producing bacteria than those with normal blood pressure.
Certain gut bacteria, particularly Akkermansia and Faecalibacterium, ferment dietary fiber and produce short-chain fatty acids.
Them. What depletes them? Primarily low-fiber diets, the default pattern for most Western adults after 60.
The good news, these bacteria respond quickly to dietary changes. Adding fermentable fibers, inulin,
pectins. Foods rich in these fibers, cooked in cold potatoes, green bananas, oats, chicory root, garlic, onions. A single broad-spectrum antibiotic course can eliminate up to 30% of your gut bacterial species, including many of those butyrate producers we just discussed.
Factor number 4, the lasting gut disruption from antibiotics taken months or years ago. This one surprises almost every patient the first time I mention it.
What most doctors never warn you about, full microbiome recovery after antibiotics can take 6 months to 2 years. Adults over 60 have typically completed multiple antibiotic courses. Each one reshaped their bacterial community.
Research now suggests that people with a history of frequent antibiotic use have measurably altered gut microbiomes and higher rates.
Strains like Lactobacillus rhamnosus GG and Bifidobacterium longum have specific research behind them for post-antibiotic restoration.
You can't undo past antibiotic courses. But rebuilding is possible, with specific bacterial strains by evidence. Factors 2 through 5 create the conditions. Factor 1 is the mechanism itself, the direct path from your gut to your blood pressure. This is what most doctors never test.
Factor number 3, non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, aspirin in high doses. Most adults over 60 take them regularly. Many take them daily. NSAIDs work by blocking prostaglandins, the same compounds that protect your intestinal lining. A damaged gut barrier becomes permeable. Gaps form between intestinal cells. This increases those bacterial fragments, specifically molecules called lipopolysaccharides, trigger an immune response. Your body reads them as coolant. Stiff, inflamed vessels cannot expand normally. Your heart pumps harder. Pressure rises intent.
Don't stop NSAIDs without talking to your doctor. What I want is for you to ask specifically about gut protection strategies and alternatives worth exploring together.
Gut protective strategies include taking NSAIDs with food, using the lowest effective dose, adding zinc carnosine.
Factors 2 through 5 create the conditions. Factor 1 is the mechanism itself, the direct path from your gut to your blood pressure. This is what most doctors never test.
Factor number 2, ultra-processed foods tween, specifically the chemical emulsifiers added to almost everything in a package. Polysorbate 80. Inside your gut, these emulsifiers dissolve the protective mucus layer lining your intestinal wall, the same barrier that keeps bacterial fragments from entering your bloodstream. Think of that mucus layer as a submarine hatch seal. When emulsifiers erode it, the hatch begins leaking. The average American adult consumes emulsifier-containing foods at least 3 times daily without knowing it. Salad dressings. Early human research links emulsifier exposure to elevated gut inflammatory markers, the same markers consistently found elevated in patients with uncontrolled hypertension.
These additives were approved based on short-term studies. Nobody tested cumulative daily exposure across 30 years.
The 3 to avoid: polysorbate 80, carboxymethcellulose, and carrageenan. Seeing any one of them on a label means that product is actively.
Factors 2 through 5 create the conditions for factor 1, and factor 1 is where the science becomes impossible to ignore. This is what your doctor is most likely not testing. The intervention here is simple. Not easy, but simple. Becoming a label reader. Looking for 3 specific ingredients before putting anything in your cart. LPS endotoxemia, that is its name. LPS, BID, lipopolysaccharide BID, is a molecule forming the outer wall of.
In a healthy gut, these bacteria stay contained. The intact intestinal barrier keeps them where they belong. But when intestinal permeability increases, from NSAIDs, emulsifiers, dysbiosis, LPS molecules begin.
Factor number 1, the finding that stopped me cold. The one that should reshape how blood pressure is treated in every adult over 60 worldwide.
Your immune system detects them instantly and launches a response. Not an acute infection, but something more insidious. Depressed. This chronic LPS-driven inflammation does specific things to your blood vessels. It reduces nitric oxide production, the molecules. Stiff, inflamed vessels cannot expand normally. Your heart pumps harder, pressure rises, and because the inflammatory source. Multiple peer-reviewed studies now show that elevated LPS levels in the bloodstream are significantly associated with hypertension.
Let me tell you about a patient I'll call Gerald, 68 years old, retired engineer. 4 years of medication adjustments. His blood pressure simply would not stabilize.
When I evaluated Gerald, his LPS markers came back 3 times above normal. His gut barrier was in serious disrepair. We addressed his gut health, dietary changes, targeted supplementation, removing the emulsifiers. Within 4 months, his blood. Gerald is not unusual. Metabolic endotoxemia, chronically elevated LPS, may be present in a substantial portion of adults whose blood pressure resists standard medical treatment.
His cardiologist later reduced 1 medication. I want to be clear. We did not cure hypertension. All 5 factors covered. You can see how they connect, each feeding the next, all converging on the same inflammatory endpoint. If your blood pressure has resisted medication for years, ask yourself one question, Tess. Has any doctor ever evaluated your gut health as part of your treatment?
Step 1. Remove the 3 barrier-destroying emulsifiers. Spend 1 week reading labels. You will find polysorbate 80. Replace them with whole food alternatives. Plain fermented yogurt, olive oil dressings, bread with minimal ingredients.
Step 2. Actively rebuild your butyrate-producing bacteria. This means 2 things simultaneously. Adding fermentable fiber foods daily.
For fiber, aim for 25 to 30 grams daily. Prioritize cooked and cooled potatoes, oats, garlic.
For probiotic support, look for Lactobacillus rhamnosus GG, Bifidobacterium longum, or Akkermansia mucin.
You're not asking your doctor to step outside their specialty. You're asking them to consider a well-documented mechanism that cardiovascular medicine is increasingly recognizing.
I've been learning about gut bacteria and blood pressure, and I'd like to discuss whether intestinal permeability testing makes sense for my situation.
None of these changes produce overnight results. The gut microbiome rebuilds slowly. Meaningful shifts in
4 weeks of consistent changes is a small investment compared to years of medication adjustments that never address the underlying gut-driven inflammation driving your numbers up. You came here managing a chronic condition. You're leaving with 5 specific mechanisms, 3 actionable steps, and 1 clear conversation to start with your doctor this week. My goal was not to frighten you, Paim, only to show the gap between what gut science now knows and what most hypertensive patients are ever told about their condition. Every change counts. removing one emulsifier, adding one fiber source, asking one new question at your next appointment. Type GUT in the comments if any of these 5 factors resonates with your own experience. I read every reply, Bim. Your response tells me what to cover in future videos. If you know someone whose blood pressure refuses to stabilize, send them this. It may be the single piece their medical team has never once thought to investigate. Next week, I cover the specific probiotic strains research links to better blood pressure outcomes. Not what's on pharmacy shelves, but what the cardiovascular data actually supports. If this is your first video of mine, subscribe. Every week, I cover the gut connections that standard medicine hasn't yet fully brought into the exam room.